Hi, I'm Dr. Cullen Ruff. I've been a radiologist at Fairfax Radiology for over 23 years, specializing in abdominal pelvic imaging. Fairfax Radiology Centers is the largest radiology practice in the DC metro area, with 20 offices throughout Northern Virginia. Radiologists are doctors who have gone to medical school just like surgeons, internists, pediatricians, but we're often a little more invisible to the patients because we work behind the scenes interpreting the medical imaging studies that you have had, whether it be x-rays, CT scans, MRI, ultrasound. We interpret these studies and communicate these findings to your doctor or other referring healthcare provider, as well as provide this report for you. People wonder sometimes what radiologists do, and of course much of our work does involve the interpretation of images. Again, x-rays, MRI, CT scans, ultrasound, nuclear medicine, the various studies that can image the human body. Imaging is used for a variety of reasons, sometimes for screening for disease where there may not be even any symptoms, like screening mammograms, for example. Sometimes there are symptoms, and imaging can be used to find everything from fractures to infections to tumors, stroke, heart conditions. And then sometimes the images are not only used to make the diagnoses, but also to help us guide invasive procedures. Again, for example, if a tumor is found and it's indicated to do a needle biopsy to figure out what it is, this is the type of study and procedure where imaging may come in useful. Typically, when patients have an imaging study, you do not meet the radiologist directly by the sheer volume of studies that we interpret. But we make sure that we do a thorough analysis of your images, compare that to any other information available, including the provided history. Sometimes there are blood tests, pathology reports available, and then we use all of that information to provide the best reading that we can to your provider and the report that you have access to as well. Because we are such a large, specialized group, that should give patients reassurance that whether you're having a mammogram or a knee MRI or an abdominal CT, that the radiologist who's doing that reading and interpretation is experienced and has expertise in that particular body area and technology in order to give you the best and most accurate reading possible. On a personal level, working as a radiologist is very rewarding and very interesting. It's really rewarding to help other physicians in terms of looking at all of the information that we can on human imaging studies, helping make all the diagnoses we can that then helps guide treatment, whether someone needs antibiotics for an infection, surgery for certain conditions, chemotherapy, if tumors are found. It's very gratifying and interesting to find the different conditions that happen within the human body and to be part of that healthcare process in order to make diagnoses and help treatment. If patients need more information, that is available at fairfaxradiology.com.